Ashley. And again, good afternoon to everyone. Thank you all for logging in to discuss individual and family plans. I know it's right around the corner that open enrollment begins. Actually, that's on Monday, November 1st. So it's a perfect time for us to share with you what we have available, and then also to give you a little bit of background, as Ashley mentioned, about the plans and how the marketplace all began. So let's get started here. All right, now some of you may be very familiar with Security Health Plan and who we are, but this again is just a nice starter piece here. We are the 6th largest HMO in the state, and we do offer individual marketplace plans, as we're going to focus on today, but we also offer plans through small and large employer groups, Medicare, and Medicaid. Now there are 3 plans that we're going to focus on today that you can purchase through the marketplace. One is called Enrich, the other is Select, and then simply one is the third. Depending on where you live within the state would be the plan that you would be eligible for. And again, I'll get into more details as we go. I also want to mention our world-class customer service. This is a big piece of when you invest into a health insurance company. Of course, you're going to check price, coverage, can I see my doctor? All very important things. But you also want to make sure that you have a quality program that you're investing into, because you'll be staying with that program, hopefully year after year, to make sure that you're getting the highest level of care and customer service. And so we have received customer service excellence awards from an outside vendor, not just what we say, stating that we do provide that. So we hope to always do that. And of course, we're your friends and neighbors, all just trying to make sure we all understand and get the best plan that we can. All right. Now, the Affordable Care Act has expanded the benefits. So prior to the Affordable Care Act, there were limits on certain things. Well, now there are no lifetime limits, meaning if a person should go in for a medical treatment and that treatment it goes to, let's say, $500,000, there's no maximum cap on that any longer. So a person would still continue to get those services covered by their health plan. Also, what it did is it limited how much you would pay for your out-of-pocket expenses. So for next year in 2022, most a person could pay out-of-pocket is $8,700. So that could be in a combination of a deductible, co-pays, co-insurance. It doesn't include your monthly premium, but what you pay for your medical care. Also, coverage is guaranteed, so a person cannot be turned down or denied due to previous health conditions or health conditions you may be experiencing. And there's no pre-existing limitations or waiting periods. You don't have to wait 12 months before certain coverages begin. The whole policy begins right away. Now, the way to find out what the cost will be are a few different things. It's set by age, where you live, what county, how many people are in your family, if you use tobacco, and then of course, the provider network you'd like to use. Now, essential benefits are included in all plans, and I'll point out what those are as we go along. Some people will ask me, yeah, I need one of those individual plans. And I'll say, would you like it through the marketplace? I don't know. It seems like they're all the same. Well, in a way, they are all the same as far as what they're called. Sometimes people call it marketplace. Sometimes people call it FFE or FFM, a federally facilitated marketplace or exchange. ACA, some people used to call it Obamacare. It's all the same concept and the same thing. It's just called different names. So it's where you can go online, put in that information I discussed, and it'll show you what plans are available to you. Now, the government doesn't actually provide plans. They created the ACA or the marketplace so that they could have certain financing rules, meaning how much you can get for a tax credit. That's the portion the government will pay for you. But the health insurance is actually provided by your carrier, such as Security Health Plan. Sometimes people will ask, do I have to enroll into the marketplace? No, there are other ways that you can enroll directly through Security Health Plan. However, you would not qualify for a tax credit or a subsidy. To do that, you would have to enroll through the marketplace. Now, there are different tiers or levels, ways to see that you can get your coverage paid. So for example, if you want the smallest out-of-pocket or deductible, that would be a gold tier. It's also going to have the highest premium. Or maybe you say, I want the lowest premium possible. I'm okay with having a higher out-of-pocket. Then we would look at a bronze plan. So let's take a look at that. So again, the bronze plan is for someone who is pretty healthy, You know, you want your routine physical, and I'll talk about our preventive care here in just a moment. It's got a higher deductible, again, typically a smaller monthly premium. Our silver plans are maybe middle of the road. You might have a few health concerns, maybe taking some prescriptions. Certainly this might be a plan for you. And depending on your income, if you look at a silver plan, you may also get what's called a cost sharing reduction. Basically what that means is it could decrease your deductible or your out of pocket, again, depending on your income. Then we have the gold plans. The gold plans, again, for somebody who maybe goes in for more services or likes the idea of having the smallest out of pocket. Certainly they would look at a gold plan. Now, our catastrophic plan is only for people under the age of 30. You still get all the regular preventive care benefits, and it is a higher deductible plan. Now, if you are a person who likes to have an HSA, a health savings account, we do have two plans that you can purchase that do offer for you to still contribute to your HSA, and then you can use that money to pay towards your deductible to get that tax savings. All right, now we need to look at the provider network. With any of our individual or marketplace plans, whether you're buying it on or off the marketplace, they do include the Marshfield Clinic Health System. There's many different hospitals throughout the Marshfield Clinic Health System and many different clinics as well. Now, with some of the plans, there will be some ability to go to other providers as well, and we'll discuss that. So let's start first with our Select plan. I mentioned there was 3 plans. The Select plan is available for people who live in the northwestern part of the state. So you can see here that would be Ashland, Barron, Bayfield, Buffalo, Burnett, Chippewa, Douglas, Dunn, Eau Claire, Iron, Jackson, Pepin, Rusk, Sawyer, Chempalo, and Washburn counties. So with the Select plan, if you can see on the right side here, it does have the list of providers. So of course, as I mentioned, the Marshfield Clinic Health System, also Essentia Health on the west, Prevea Health, HSHS, which the Hospital Sisters Health System, and some Oakleaf clinics. Those are all considered in-network on the Select plans. Next, we have the Simply One plans, and that's more in the central and northern, little bit east counties. So again, that's going to starting on the south, it's Adams, Juneau, then Wood, Portage, Wapaka, Clark, Marathon, Shawano, Menominee, Langlade, Lincoln, Taylor, Price, Oneida, Vilas, Forest, and Florence. So if you live in one of these counties, this would be the plan option for you. Now, this plan does have Marshfield Clinic as its main and primary provider. Now, of course, if there are certain specialists, such as mental health, chiropractic, autism clinics, that the Marshfield Clinic Health System does not have available, we would have those as part of our network as well. And I encourage you with any of these plans, the most up-to-date way to find out if your provider is in network is to go onto our webpage, securityhealth.org. The very top of the page, there's a Find a Doctor button. Click on that, put in your information, and then it'll bring up either specialties or it can bring up the whole range of different providers. So that's the best place to look for those providers. And then we have our Enrich Plan. Now, our Enrich Plan is available to one county right now, and that's down in Dodge County. And some of you may not be aware, but the Marshfield Clinic Health System did purchase the Beaver Dam Hospital. So that would be the major hospital down in Dodge County. Also, providers down there are UW Health and Unity Point Mariner. So if you live in Dodge County, Enrich would be the plan for you. Now let's go back and look at some of those essential benefits I mentioned before, and then we'll talk about preventive care. So essential benefits means any health insurance carrier that offers a marketplace plan has to include these as part of their package or their coverage. So you have your ambulatory or your outpatient care, emergency services, and I wanted to mention on any of our plans, you do have coverage for worldwide emergency or urgent care services. So if you're traveling, something should happen, you go to the nearest facility, show your card. Of course, if you're out of the United States, they will ask for a payment. Keep your receipt so we can reimburse, but you are covered if you're traveling. Back to the essential benefits, inpatient or hospitalization, maternity and newborn care, mental health and substance use disorder services, prescription drug coverage, rehabilitative and habilitative services and devices, your labs, then the preventive and wellness services along with chronic disease management, and then the pediatric services for the kiddos, including the oral and the vision care. Well, all of this information is available on our webpage. It's also available in printed form. So after the webinar today, if anybody would like that information, I'll have our phone numbers at the end. Either give us a call or again, jump online and we can send you that information as well. All right, now let's take a look at the preventive care services. Again, all marketplace plans must cover these specific preventive care services without charging a copayment or a coinsurance or a deductible. So even if you've got that high deductible health plan, these are still covered at no cost as long as it's with one of our affiliated providers. We've got diet counseling, your immunizations, blood pressure screening, cholesterol screening, colorectal cancer screening, type 2 diabetes screening, hepatitis C screening, HIV screening, lung cancer screening, and screening for sexually transmitted diseases. So these are all considered part of the preventive care services. But that's not all. We also cover your annual exam. So your routine physical, your head to toe checkup, that's also a covered benefit, along with your labs. So if you need to go in once a year, get your labs checked, see if you need to modify medications, anything like that, we do it differently. On a lot of other plans, that would go toward your deductible, but not with our plans. That's still covered under your preventive care benefits. We also cover your mammograms, pelvic exams, prostate cancer screening exams. Those are also part of our preventive care that we offer above and beyond what the marketplace requires. Also, some of our plans have these perks. So if you're looking at our plans and you say, okay, what else can I get besides the coverage itself? Well, you do get $30 every quarter in over-the-counter credit. So we send you a catalog, or you can jump online and you fill out the information of what you'd like, things you're going to purchase anyway. So acetaminophen, Band-Aids, toothbrush, toothpaste, things like that. So that's a great benefit to have. Also access to our 24-hour nurse line. And from that, you could also get Care My Way. What that is a more specific time with a nurse to talk about conditions you may be experiencing, or symptoms, I should say, and they can determine whether or not that's something they can assist you with over the phone and possibly send a prescription to your pharmacy to pick up. And then that saves you an office visit cost, and it also saves you going into the office. So that's a nice feature, and there's no cost there. We also offer health coaching and care management. And again, no cost preventive services, as I mentioned. And then last is our global fit. So this is a different way if you'd like to go ahead and do different classes online, maybe start a tracking program of walking or whatever it might be, we can help with that. And all of this information, again, is available online. Now let's get into the costs. I mentioned before there's subsidies or tax credits. So the first thing we're going to talk about is subsidies. They're called cost sharing reductions. Again, this is only available on the silver tier plans, which was that middle of the road plan. If your income is of a certain level, we put that in and it will tell us that you will have a reduction on your medical expenses. So your deductible would go down. Sometimes your coinsurance also would go down. So that's why it's always so important to check on the marketplace to see what is available to you. The second piece here is the advanced premium tax credit, or simply a tax credit. Again, based upon your income, your family size, all of that, it will tell you how much the government will pay towards your monthly premium. That's called a tax credit. It's not something you have to pay back. Okay, it's something that they provide, and they pay directly to the insurance company. And that will tell you, again, what your premium will be. Okay. If for some reason you say you make, let's say, $30,000 a year, and when you do your taxes at the end of the year or at the beginning of the next year, you actually make $40,000. Well, then the government would say, okay, we paid based on your $30,000 figure, so you would have to pay that back on your federal tax return. Now, if you underestimated, excuse me, then you will be able to get that tax credit as well back on your income taxes when you file. Okay, so that's how that works. This last year, the American Rescue Plan Act was instilled for the marketplace plans. What this really means in a nutshell is we used to have up to a certain threshold of income. A person could get a tax credit. Now that threshold is a lot higher. So a person who has a little bit higher of an income could still potentially get a tax credit. It also means that no one will pay more than 8.5% of their household's annual income for the second lowest cost silver plan. I know that's a lot of words. So again, basically what it means is it's making sure that it's not a phenomenal cost that you cannot afford. So they've extended how much you can make and still get a tax credit. And we found 4 to 5 enrollees sometimes can find plans for $10 or even less. And with these plans, the subsidies are retroactive back to 2021. So if you're on a plan today, it pays to go out to the marketplace even now and go in and update your income. Okay, even if it's the same income, you haven't had any changes, because of this new threshold, you may be able to get more of a tax credit. So again, it's worth it to check it out. All right, if you're currently enrolled on a marketplace plan, you can go to healthcare.gov to update your application to get that increased subsidy. If you're outside of the marketplace or you're currently not on any type of health insurance, you would just go on to securityhealth.org/IFP plans, and then we can help you enroll. If you want to talk with someone about this, we also have our sales staff available to talk. Their phone number is 844-221-9345. And certainly we can help you in that format as well, either one. Oops, too far. All right, this is just again what we had mentioned with the new American Rescue Plan Act. Really what it's designed to do is make sure that you're not paying such a high premium for health insurance. So I can't stress enough, go out, update your income, even if it's the same, just to see what the new amount could possibly be. When you apply, things that you will need, of course, is your social security number or document number for any illegal immigrants who need coverage, and then employer and income information. So if you know how much you make on a semi-annual or monthly or bi-monthly, that's fine. Okay, just so you have a nice, good number. It doesn't have to be to the penny, but again, you want to try to stay as accurate as you can for everyone in your family. And this often gets asked, let's say you are going on a marketplace, but maybe a spouse or a family member is not, because maybe they have coverage through an employer, through Medicare, something else. You still have to put the entire family's income, even though you may be the only one who needs coverage, because they determine it off of your taxes. So if you're filing jointly, that's the number they will need for you to put in. All right, if there is any information regarding a job that does allow for you to have health insurance, you also want to have that information available. And of course, an email address to set up the plan, to receive your documents and so forth. Now, enrollment starts on Monday, as I mentioned, and it goes through January 15th. So this is an extension. Typically, it would only go through December 15th, but this year it's extended. Now, you can already go out there and take a little sneak peek of your plans if you go out here, but Monday is when you can actually get the full amount, and then, of course, also make that enrollment if you'd like to. Now, I know I said that enrollment was open until the 15th, but this is really important because from November 1 through December 15 is when your policy could begin January 1st. You enrolled during that 45-day. If it's between December 16th and January 15th, then it won't start February 1st. So then you'd have that 1 month of no coverage. So even though they've extended it, if you're looking for a January change or start date, December 15th is still when you would need to get that enrollment done. All right, so to wrap up here, and I can take a few questions as well, or you can put them in the chat, but to wrap up here, this is how you can get started. Again, you can call us, okay? You can go online, or you can email us. Let us know how we can help you. If you'd like us to generate a quote for you, again, what we'll need is your ages, your zip code and county, how many people and their ages on the plan, if anyone uses tobacco, and then what you estimate your annual income will be. And then we can get those quotes sent out to you. So that's the information. that you'll need. I want to thank you all. I know some of you have to get going, so I appreciate your time with me here this afternoon. I will open it up for a few questions for anyone that should have any. But again, thank you very much for joining today.
Ashley, this is Carol White. I am wondering, are there seminars like this for people who have security health for Medicare?
Yes, I believe your question was, are there webinars like this for people who have Security Health Plan Medicare?
Yes.
Yes, absolutely. We have quite a few webinars on our Medicare plans. I don't have the dates right in front of me, but if you give that same number a call, I'll go back, that same number a call, and they will tell you when the next webinars are, and they can register for you for those as well.
Great, thank you.
You're welcome.
This is Teresa. You talked about the perks of the over-the-counter. Where is that located and how do I get there?
Sure. So the over-the-counter benefit, if you're currently with us, you would have received a catalog earlier in the year. However, if you don't have one or you'd rather just do it all online, I can't bring up the web page from my computer right now or it'll shut down everything else. But there is, if you go actually to the homepage, there's a little search space. And if you put it over the counter, then it'll bring you to the link. We'll have that information on there. So again, just go to our webpage, securityhealth.org. On the top right, there's a little search field to type in free space, type in over the counter, and then it'll bring you to the options. Because we do offer this also on our Medicare plans. So you'll see the option there for the marketplace.
Okay, one question we received from our audience. How do you pay for the plan each month?
Okay, great. Thank you for the question. Yes, so to pay for the plan is a couple different options, really. You can get billed by mail. We can take it out of checking, saving, or credit card. And you can pay the day you enroll if you go online, or if you're having someone help you with that, then we set you up with our enrollment team and they will send out that information to you. So basically any way you want.
Hello?
Yes.
And I'm just new, I have the Security Health just for 1 year. To re-enroll, I have to re-enroll like I did last year.
Okay, thank you so much for bringing that up. So to re-enroll, if you are not going to make a plan change, you do not have to actually go out and do anything. But again, I would suggest that you do go out and at least put in your income, even if it's the same, so you can see what the best tax credit is for you, how much you can get.
Okay.
But it automatically stays with you. So you don't have to re-enroll. It will just continue forward.
Great, thank you.
You're welcome.
And I don't see any other questions coming through our chat feature. Oh, nope. Here's one. Spoke too soon. This question is from one of our audience members. It is, we spend a few months in Florida during the winter. Insert, I am jealous and envious of that. What if we need medical assistance and it's out of network? I believe that emergency services are covered. But what about more minor items such as a bad cold, x-rays to check for pneumonia, etc.?
Sure. And I'm jealous too. Have fun in the sun. But so we do cover emergency care and urgent care. So if you go to a walk-in or an urgent care because you feel you've got something going on, you don't know if it is a cold or if it could be something else, that would be considered urgent care. Now, if you're in the say urgent care facility and they say, oh yeah, we are worried about pneumonia, let's do an x-ray. That still is considered an urgent care service because it's all being done there. Once you leave urgent care, and let's say you come back in a week for a follow-up, that's where that's not going to be a covered benefit because now it's not urgent, it's a follow-up. So then you would pay whatever that cost is.
Another question that we received. What if you only need 10 months of insurance and then you will be on Medicare? What do you use for the income, the whole year or 10 months of income?
Oh, that's a great question. So you still will want to use the whole year. I realize that you're only going to be on for 10 months, but they look at your whole year of taxes when they do the reconciliation. So you would want to use the whole year. And then after, you're on for 10 months, make sure that, of course, once you get your Medicare card, which should be about 2 to 3 months before your Medicare start date, that you notify us so we can get you on the Medicare plan that works for you. And then we can also help you get disenrolled from the marketplace so that you don't have double premiums.
Great question. Another question that we had, where do you look to see what prescription drugs are covered under the plan?
Yes, that's a great question as well. So the way that I always do it, again, I always tell people to go to that search field. And if you put in formulary, that's what we call our list of covered medications, it's going to bring you to 2 options, either the Medicare formulary or the marketplace or individual family plans. Click on there. Then from there, you can either type in your medication or you can do a search just by the letter of the alphabet that it starts with.
Any other questions from our audience? I'm not seeing any in the chat feature. Going once. So I think with that, we can go ahead and close a few minutes early. I just want to remind everybody on the call today that we will be emailing a link to the recording following the presentation. It might be a few days, but we will get that to you. And we're also going to include a few links to some helpful resources for more information. And I think with that, we can go ahead and close.
Wonderful. And one other thing I was going to mention, stay tuned. We will be having another webinar on more specifically this Simply One plan. So for those of you who live in those counties, watch for that information because I'll be talking more specifically about those benefits and those extras.
Great. Well,
Right,
thank you so
you.
much, everybody, for joining us. Thank you, Kay. And I guess stay healthy and well, everyone.